Good morning. I'm Dana Atkinson, and I'm with the Foundation for Recovery, and we're here to talk to you about the Million Hearts Initiative. The Foundation for Recovery provides opportunities for people and their families to achieve long-term recovery from the disease of addiction. The Foundation for Recovery is proud to have been chosen as a partner with Million Hearts. It's a national initiative that has set an ambitious goal of preventing 1 million heart attacks and strokes by the year 2017. And I am here with Heidi Gustafson with the Foundation for Recovery and with Jason Belland, who is the Executive Director of the American Heart Association. Jason's here to talk to us about heart health and a healthy lifestyle as it relates to the recovery community. Hi, Jason.
Hello, thank you so much for having me here today.
Thanks for being here.
I'm delighted to share some information about how each of us have the opportunity and the power to build a healthier lifestyle. There's a few things that we will roll through to talk about how each of us have the opportunity to make those personal choices on a daily basis. The first thing that we'll talk about is what some of the goals are that the American Heart Association has, as well as the progress that we've been able to make, some projections over the course of the next several years, a model for success, and then programs and support that we have the opportunity to provide to you. The goal that the American Heart Association has is to improve the cardiovascular health of all Americans by 20% while reducing the deaths from cardiovascular disease and stroke by 20%. Some of the progress that we've been able to achieve to date in regards to reducing deaths from heart disease and stroke are related to coronary artery disease. We've been able to reduce by 14%. Stroke deaths have reduced by 10.8%, and total cardiovascular deaths have reduced by 10.1%.
That's incredible.
As far as the information that we have about the improved cardiovascular health of all Americans by 20%, unfortunately we don't have any data available as of yet to this decade, but we do have or will have additional information available on our resources, www.heart.org, as that information does become available. Some of the projections that we're looking at as far as improving cardiovascular health are a lot of times related to physical activity as well as a healthy diet. Those are two things that we absolutely have the ability to change each and every day. Smoking, high cholesterol, and high blood pressure are things, unfortunately, that are worsening and that we want to be able to improve. And if the recent trends continue in cardiovascular health, behavior, as well as health factors, cardiovascular health will only improve by 6% by the year 2020. Our goal is to improve that or reduce that by 20% by the year 2020. However, small improvements make a big difference. Improving one health behavior in the next category can reduce your risk of death by heart disease or stroke by over 21%. So as we take a look at the 2020 Health Impact Goal model, we see several different things here. The health behaviors that we have the opportunity to impact on a daily basis related to physical activity, a healthy diet, tobacco usage, smoking mainly, as smoking is the #1 preventable risk factor that we have.
And I think that that's an important thing to mention, especially for the recovery community, Jason. As they experience recovery, one of the things that seems to linger for a long period of time is the smoking, and teaching them about smoking cessation and the benefits of reducing or eliminating tobacco in their lives.
Absolutely, and as we know, over the course of if you quit smoking, there are improvements literally within weeks. And so as we talked a little bit about beforehand of those small changes making a big impact, it can be, cold turkey is obviously difficult for anyone.
Absolutely.
So make small choices and changes that can gradually lead to that ultimately maybe of not smoking at all. As we look at the physical activity and a healthy diet, the implementation of increased physical activity or the implementation of a healthy diet ultimately will assist with a healthy weight that each of us will be able to have, And ideally that being able to be determined by a medical professional that lets you know what is your ideal weight and what are the best ways for you to get there. Some of the health factors that are related to our behaviors are blood pressure, cholesterol, and glucose. Related specifically to those, blood pressure, you really want to understand what is the right blood pressure that you want to be at, and really having it be over several times of taking your blood pressure. Just taking it once and it might be high doesn't necessarily mean that you have high blood pressure. You might have just run up a flight of stairs, been stressed out from a phone call, whatever it might be. So really having a baseline over a period of time, several instances of taking your blood pressure to really determine, do you have high blood pressure or hypertension? And then if so, how can you work with your health professional to be able to reduce that?
Exactly.
And then with cholesterol, really understanding what is the cholesterol levels that you have. The best example that I've heard from a great cardiologist was understanding what is the HDL and the LDL. The HDL being your happy cholesterol, and the one that's okay to be a little bit higher. But the LDL and the lousy cholesterol is the one that you don't want to be high. And understanding how you can reduce that lousy cholesterol that you might have by the increased physical activity or the healthy diet, even the reduction in your weight. And blood glucose goes along with those as well. And then what we've found through the research conducted by the American Heart and Stroke Association is that the implementation of those health behaviors, as well as the results of those health factors, will ultimately help to reduce your risk factors for an acute event or mortality related to a stroke or heart disease. And the American Heart and Stroke Association is working through science and research, communications and awareness, as well as our development efforts that ultimately help to fund the research and public health education programs that are implemented within the community.
Great information.
So as we take a look at a few more details of the programs related to those health behaviors, as we look at physical activity, one of the great things that we have available is walking clubs in numerous communities where individuals get together and they set a time where they're going to be able to go out for a walk. It might be some neighbors, it might be people meeting at a community park, things like that. We also have resources to be able to set up walking paths that are taking place. You can develop a fitness plan on some of our heart resources at heart.org, Heart360, which we'll talk a little bit about later on. And our heart walks, we actually have over 300 heart walks that take place throughout the entire country that allow individuals to participate, get a lot of educational information, and if they have the resources, to be able to help generate funds and raise funds to support the American Heart and Stroke Association. Some policies that we're trying to implement through advocacy related to physical activity are active community designs, which could be the availability for walking paths and trails in a particular community, safe routes to schools, not only for children, but maybe for their parents that want to walk to school to pick up their kids as opposed to have to drive and do that. We want it safe not only for the children, but also for the parents. And then counseling in the clinical environment to really be able to have those discussions with your physicians and their assistants in regards to what are the exact exercise implementation plans that we can take advantage of that will help to improve our ideal cardiovascular health. Some of the programs related to nutrition are teaching gardens, whether it's a community garden that might be there helping to grow fruits and vegetables and teach kids actually what they are. Through some of the research that the Heart Association has done, is we've actually shown kids fruits and vegetables, and unfortunately they can pick out French fries, but they don't know what broccoli is.
Yeah, exactly.
And so being able to understand what are those heart healthy fruits and vegetables that we need to be eating on a daily basis is something that our Teaching Gardens program is addressing. Obviously, cooking with heart and improving the way that we are cooking. What are the healthy oils to be cooking with? What are the oils that we want to try to avoid? What is the healthy fat, the unhealthy fat, the things like that? A great program that we've recently introduced is our food and restaurant certification program. You might have recently seen, or when you've gone to a grocery store, the heart check mark that's on some breads or other products within the grocery store. And now that heart check mark is making a presence in a lot of restaurants. And restaurants actually have the ability to have some of their meals certified by the American Heart Association that meet the dietary recommendations for a balanced meal. And so you'll probably start seeing that in a lot more stores. I know you'll see it on Subway restaurant menus and things like that. So that's something that is extremely beneficial. And then the consumer sodium campaign, obviously salt is a big part of a healthy lifestyle, and so the reduction of sodium and salt in our daily meals is something that can be extremely beneficial as well. From an advocacy perspective, some of the things that we're working on related to nutrition are within the schools. We know that if we can help to prevent obesity early, then we can ideally help to tackle that on a much larger level. Unfortunately, this is one of the first generations of children that aren't going to live as long as their parents because of childhood obesity.
Oh, isn't that sad?
So it's something that really does need to be addressed, and something that the American Heart and Stroke Association is extremely focused on.
I don't think people realize that. You know, we've lived so healthy for so long, and our lives have become extended, and now we've developed habits and behaviors that are going to decrease that. And
absolutely.
We need to get that message out.
Absolutely. And then the health behaviors, as I mentioned earlier, with tobacco, the clean indoor air laws, which the American Heart and Stroke Association is working on, healthcare coverage for tobacco cessation, and I know you had mentioned that earlier. I think that the changes that are going to be coming along with the Affordable Care Act are something for individuals to continuously talk to their healthcare providers about and what resources might be available to them. And then advocacy issues related to weight and obesity screenings and BMI, and really understanding where they're at and the decisions that they have the ability to make.
Right.
So as we take a look at the health factors and the blood pressure and where we're at, there's several programs of the American Heart Association that can be beneficial in addressing all of those. Our Guideline Advantage program is working from an outpatient perspective to be able to improve, to implement a quality improvement program for those that might be just visiting their primary care physicians. Our patient educational materials are fantastic to be able to visit, and actually many of them are available through our websites now, heart.org, Heart360, and different things. And then for heart disease and stroke, for the acute events, we're working to have quality improvement initiatives within the hospital setting. So obviously none of us ever want to go to a hospital to deal with a heart attack or a stroke, but our quality improvement initiative program is helping to make sure that if somebody does have to be treated at a hospital, there's certain guidelines that are established that all of the hospitals participating in our Get With The Guidelines program are following to make sure that they have the best possible outcome. Many of the outcomes are measured by minutes, because with a stroke, time is essential. You've really got a 90-minute window to be able to provide the best potential outcome, and anything outside of that 90 minutes, unfortunately, we see a reduction in the quality of life after that.
Wow.
And then at the bottom, you'll see some information on the science and the scientific journals that we have, media and communications and awareness, and then of course the development that we had mentioned earlier that helps to fund all of those programs. And as we continue to improve the cardiovascular health of all Americans by 20%, we have programs related to My Heart, My Life, which are working, as we mentioned earlier, with the teaching gardens, simple cooking. If companies and they have the ability to implement a wellness program, our food certification program, all of these things listed on this page are available at our website, heart.org, in different links. The great thing about our website is that it has the ability to translate into Spanish and other languages. And so there's a button that you can click on that will allow you to be able to take a look at the educational information that's provided if needed.
That's wonderful.
And as we continue reducing the deaths from heart disease and stroke, many of the programs that we see implemented within the community are going to be extremely important. CPR is essential, and bystander CPR. Unfortunately, there's only about an 8% survival rate of individuals suffering from some form of cardiac arrest if they don't receive CPR within a certain period of time. So we want to increase the exposure and the awareness of individuals to do hands-only CPR, and there's resources available through our website, heart.org, for that as well. And then the Get With the Guidelines program and the Guideline Advantage that we had recently mentioned are really helping to reduce those deaths from a patient perspective inside the hospital and at your primary care physician.
Wonderful. Thanks, Jason. We really appreciate you coming and talking with us today. And Heidi, I'm going to let you wrap up.
Okay, so how can you stay informed? You know, this stuff changes, and there's continuing research, and we're going to go ahead and keep this updated. But in the meantime, you can stay informed on a regular basis by visiting a few websites. Of course, there's us, forrecovery.org, and then there's Million Hearts, HHS.gov, strokeassociation.org, and then today we had the American Heart Association, which is located at heart.org. And everybody that is referred to on this page has a Facebook presence. So if you like them on Facebook, you'll get the daily updates on anything that's going on. And for me personally, I find that that's the best way to go, because I forget to where to go look, but it's nice to get those little alerts on my phone.
I like that too.
Yeah, it's really nice. And one more time, thank you very much to Jason. And the Foundation for Recovery would like to thank you for spending this last 16 or 17 minutes with us and learning how to take control of your life and have a healthier lifestyle.